Hello, I am Dr. Sampurna Ghosh. I am ENT Consultant in Sunshine Hospitals, Gachibowli, Hyderabad. So, today's topic is about sinusitis. Sinusitis has a lot of myths and facts which goes in the society, and most common is that all the headaches people have, they believe they have sinusitis. So, every day I get a lot of patients coming to my clinic and directly telling me, doctor, I have sinusitis. So, then I ask that what is your symptom? I have headache. You have to understand that all headaches are not related to sinusitis. Sinusitis consists of a very small portion of headache. There are other causes like vascular headache, migraine and many more. So, you have to know what is the actual symptom of sinusitis first. Sinusitis can be of two types, one is acute sinusitis and another is chronic sinusitis. Acute sinusitis we all come across in our life sometimes, which is characterized by acute cold, nose block, thick purulent discharge from the nose, pressure or pain over these areas along with fever. So, you come to the doctor with these symptoms, we give you antibiotic, a good course of 5-7 days, nasal drops and it goes and you become cured. This is acute sinusitis. But imagine if these symptoms are not curing, some of the symptoms are persisting for 4 weeks, 6 weeks, even after trying with medicine, then it becomes chronic sinusitis. So, all the investigations and surgeries and long term treatment we talk about, discuss is mainly about chronic sinusitis. So, if a person comes to us saying that I have a recurrent history of cough and cold, or I get a sticky discharge from the nose which drips down into my throat, or I have a foul smell in the nose, not able to smell properly, not able to breathe properly, I feel difficulty while sleeping. So, we suspect maybe this person may have chronic sinusitis. Yes, headache may be one of the symptom, but it is not the last symptom. So, when we suspect chronic sinusitis, we do clinical examination with the help of nasal endoscope, which I do in my OPD room, and followed by CT scan of the paranasal sinuses. So, what is the sinus? You have to understand that sinuses are nothing but air filled cavities within the skull. So, we have many groups of sinuses. The one is frontal, which lies above the eyebrows like this. The next group is maxillary sinus, which lies here, which is a space like a pyramid. So, maxillary sinus is forming the floor of the orbit and the roof for the oral cavity. Then there is a group called ethmoid sinus. Ethmoid sinus lies here. This sinus looks like a honeycomb. It has multiple small cells, and the last sinus is the sphenoid sinus, which is the deepest sinus, and just above the sphenoid sinus lies our pituitary gland, which is the gland hanging from the brain. So, all these sinuses are nothing but empty cavities. So, ideally they should be filled up with air only. If this air is replaced by some kind of liquid, it can be pus, it can be cyst, it can be or solid like fleshy mass like polyp, then it is abnormal. So, in CT scan we can see that what is the problem in the sinus. Is it curable by medicine? Sometime it may need surgery also. The surgery is called endoscopic sinus surgery, which is done with endoscope, and all the instruments also go through the nose only. So, there will be no cut from outside, it is all done seeing in the monitor. Endoscope is attached with camera and the surgery is done seeing in the monitor. It is not a very painful surgery, it is a simple procedure. Patient can stay only one night in the hospital and next day patient can go home, but all the sinus surgery patient must understand that follow up is very important with the doctor. If the doctor asks you to visit after 1 week, then 2 weeks or monthly once, there is some reason behind it. So, never, if a person says my surgery was failure, there can be two reasons. One reason can be the person did not come for proper follow up, and the second reason can be that the disease itself was bad. In the sinusitis group, there is a small percentage which consists of fungal sinusitis. Now, fungal sinusitis is notorious to come back. Even if you do a very good surgery and give medicine, it may come back. So, how to get rid of this? Only way to get rid of this is that be in touch with your doctor whenever you get back the symptoms or you have a feeling that something is bothering me, is it coming back, you should immediately come to the doctor. By checking with the endoscope we can understand and we can start the medicine as soon as possible.